Welcome to Beyond the Headlines. I'm Cheryl Jennings. Every week our show focuses on a different topic affecting people who live and work in the Bay Area. Today's program looks at health disparities in our minority communities. In particular, we'll find out who is more at risk for diabetes and what we can do to minimize the risk. But first, we're going to talk about the prevalence of hepatitis B in the Asian and Pacific Islander community. According to the Asian Liver Center at Stanford University, Asian Americans have a dramatically higher rate of liver cancer than Caucasians, and 80% of those cases are caused by chronic hepatitis B infection. About 10% of all Asian and Pacific Islander Americans have chronic hepatitis B infection, compared with 0.1% of white Americans. It's estimated 20,000 people in the San Francisco Bay Area are infected with this serious disease, and about two-thirds of them don't even know they have it. ABC 7 Health and Science reporter Carolyn filed this report this past September.
I'll talk to you later.
Anthony Chu is a successful software developer for a San Francisco business, but 7 years ago he almost died from liver cancer.
And I had a really bad stomach ache again, so this time was so bad that I had to go to the emergency room. So they gave me some medicine, and then they did some scans afterward, and that's how they found out.
Deep breath, breathe in.
It turned out Anthony had a huge tumor, half the size of his liver, but it hadn't spread. Stanford surgeon Samuel So successfully removed it.
Liver cancer in such a young man may sound unusual, but Anthony had hepatitis B, which put him at risk. In fact, liver cancer rates in San Francisco are the highest in the country, 3 times greater here than any other county in America, simply because of the high rates of hepatitis B among Asian Americans here.
The San Francisco Bay Area has a diverse Asian American population representing China, Japan, Vietnam, and Southeast Asia. But many in this community do not realize they have chronic hepatitis B.
We call chronic hepatitis B a silent killer because usually those who are infected feel perfectly healthy. You can see that these are the areas where the cancer is still alive.
Dr. So is director of Stanford's Asian Liver Cancer Center. He's on a mission to make all Asian Americans aware of the risks of hepatitis B and liver cancer.
Through all our surveys in San Francisco Bay Area, about 1 in 10 Asian Americans have chronic hepatitis B, and most of them don't even know they have been infected.
They just said I was like positive to it, I guess. I'm not sure. I forgot.
I've never heard of hepatitis B. I don't know what that is.
Hepatitis B is easily detected with a blood test. Dr. So and his staff organize clinics and health fairs like this one to get people tested. If they don't have Hep B, a simple vaccine series can provide lifelong protection.
Screen your patients regularly so you can pick it up very early.
If a person is infected with Hep B, regular blood tests and CT scans like this are necessary to detect liver cancer early, and new drugs may help as well.
There are now treatments as simple as taking a pill a day that could reduce the risk of developing liver cancer and liver disease.
Testing for Hep B is critical because it's not just new immigrants who have it. Many second-generation Asian Americans are unknowingly infected by their own parents, often at birth or in childhood. Anthony and his brother both contracted hepatitis B from their mother. Both he and his brother got liver cancer. 7 years after surgery, Anthony's cancer hasn't come back.
So far, so good. No recurrence at all. So I want to keep it that way.
Yeah, I bet he does. Well, joining us in the studio right now is the doctor you saw on the piece, surgeon and professor at Stanford University Medical Center, Dr. Samuel So.
Hi, Cheryl.
Hi, it's so nice to have you here. It must be gratifying to know that for at least this young man that liver cancer hasn't come back.
Yeah, it was very fortunate that by the time, even though it was diagnosed pretty late, we could still actually successfully remove the cancer. And in this case, it has not come back.
Fantastic.
But most of the time, you know, the outcome is not as successful.
So that's why we want to get people to be aware of this.
Right.
Just how big is it? I've read that it's 100 times more infection rate than HIV.
Yeah, it's often recognized as 100 times more infectious than HIV because it could exist in the external environment. So let's say you have a drop of blood on this table from someone who is infected with hepatitis B. 7 days later, you can potentially use that drop of blood to infect someone else.
It's that contagious.
So HIV, usually the virus will die within hours.
Oh my good. Okay. Yeah. All right. So that's the difference. Now you mentioned that blood is a way of transmitting it. Are there other ways of transmitting it?
Hepatitis B is transmitted the same way as HIV, from the mother to the newborn at birth, through infected blood, and through unprotected sex.
Okay. So we need to get the education and the awareness out there.
Right. I think if you talk to most people on the streets, they have no idea how hepatitis B is transmitted. Most people have a misconception hepatitis is transmitted by contaminated food, and that's a totally different virus.
That's the hepatitis A. Right?
Hepatitis A virus, which also could be prevented with a vaccine.
Now, you mentioned earlier, you were talking about the young man on whom you operated. He survived, but the survival rate isn't very good.
In this country, the overall chances of surviving liver cancer because of late diagnosis is about 10%. So it's actually one of the deadliest cancers in the U.S.
So we have to do something about this now. How many people, how does that translate to in the Bay Area in terms of numbers of people who could die from this?
Well, in the Bay Area, we actually have the highest incidence of liver cancer in the country.
Is it because of the Asian population?
Largely because we have like an Asian population in San Francisco of almost 35%. So Asian Americans in San Francisco is no longer a minority.
Right.
It is becoming a major public health problem in this community. And it's so easy to predict who is at risk. It's a simple blood test which costs like $5–10. And it can predict whether you would be at risk for developing liver cancer.
And where would you go to have this done?
Well, at the moment, in San Francisco, in partnership with the San Francisco Department of Health and the Asian Week Foundation, as well as scores of partners, including UCSF, CPMC, there are 7 standalone sites in the city where people can just walk in and get either free or very low-cost testing. And if they are not protected, they can get vaccinated.
Now, you mentioned San Francisco. How about other parts of the Bay Area?
In South Bay, we also have free screening at Asian American for Community Involvement. It's called AKI in San Jose. That also offers free testing twice a month. All
right, and we're going to put all that information on our website for people as we want to get them.
That'd be great, because a lot of people don't know about the importance of hepatitis B. It's like when you see a doctor, they get your vital signs, right? If you are Asian American, hepatitis B test is a vital sign, because Asian Americans are 3 times more likely to develop liver cancer, 3 times more likely to die from liver cancer. And if you just do a one-time hepatitis B test, it can predict whether you are at risk for liver cancer.
Dr. So, thank you very much.
Thank you very much.
Information.
Thanks.
All right. We have much more information for you to supplement what you heard from Dr. So. Learn more about the Asian Liver Center at Stanford University by going to liver.stanford.edu, or you can call the number on your screen, 1-888-311-3331. And tune in to ABC 7 News this week for more hepatitis B updates. Coming up next on the show, we're going to meet somebody living with the virus and learn about an ambitious program by one Bay Area city to test and vaccinate all Asian Pacific Islanders for hepatitis B. Stay with us.